I think that's a great question. So I my pregnancy, I have one son right now. I had postpartum preeclampsia afterwards.
Wow.
And I thought I was gonna die, guys. I'm not gonna lie.
Wow.
Hey, what's up, everybody? It's your boy Taz. And of course, you are listening to or watching the intro podcast. Y'all already know how we do this. Joining me right here to my left is the one and only
G baby.
What's up, G baby? And I got my homie, my brother, my partner in crime.
This Willie Baby, what's going on?
And we do this every single week. Today is a super special day. First of all, Happy New Year's.
Yeah, Happy New Year.
We have not sat down at this table since the New Year came
We
in.
haven't.
Really?
We have not.
We
I missed y'all.
We almost 20 days in.
We almost 20 days in. We are late. We are not a good family. But today is a special, special day in recognition of Maternal Health Awareness on January 23rd. Today we are joined by Dr. Faith. I am not going to screw your last name up, woman of God. Will not. But she is a board certified. Come on and say that word for me, girl, because you know I ain't doing all that.
Where I can obstetrician.
That part right there, yeah. Gynecologist at Memorial Hermann Health System and is a pioneer voice in the holistic women's health and maternal wellness. Specializing in maternal and child health, Dr. Faith provides actionable solutions to address systematic changes while empowering women with knowledge to advocate for their care. She is also one of the first doctors to bring minimally invasive, I'm kind of country doc, gotta bear with me, along with life-altering women reproductive procedures to her hospital system. Ladies and gentlemen, put your hands together for my new sister in the whole world. Dr. Faith is in the house, everybody. How are you today, Dr. Faith?
I'm blessed. How are you guys? Happy Friday.
Blessed and highly favored. Yes,
That part.
ma'am.
Yes, sir.
So just going off of the bio, in your own words, who is Dr. Faith?
In my own words, Dr. Faith is literally and figuratively a woman of faith. I'm a physician. I am a happy mother. And I am a healer. So I feel I am working in my calling to help inspire and empower women. So I'm very happy to be here on this platform to use my voice.
Absolutely. How long have you been in this particular field, or what even gave you the passion to want to do this?
So this is going to sound real bad. So I apologize to the men in the room.
Uh-oh.
My father, actually. So I told him I did not want to work with men.
Okay.
I feel as though women were very motivated to take care of themselves. For example, in medical training, we'll have situations where you may have somebody that has a chronic condition and you'll say the same thing over and over again.
Mm-hmm.
But I felt like the most motivated population of people to work with were pregnant women because they have to take care of themselves and their baby. And they listened to what I had to say. So that's kind of what inspired me to move towards more maternal health.
How does your faith or your belief interact with this particular work?
So that's a great question. So, you know, the common saying, whose report will you believe?
Come on, church.
And so I really do believe in the power of our words.
Yeah.
I do. And it's very important as physicians that we understand the power of our words so we don't speak death over our patients. We're supposed to be speaking life. So what I normally say is, hey, this is what the paper says. This is a fact I have to report to you, but I don't have the final say.
Yeah.
Right. You have, especially in OB-GYN where people are looking to have children, for example, we can do everything. And sometimes a baby just happens, right? That's not me. That's you leveraging your faith and touching, the hem of Jesus's garment. So I do believe in medicine that there's the spirit piece that we don't really talk about. We talk about, your mind, your soul,
Yes.
body, but that fourth dimension, I think is really important.
I
Just happen.
absolutely love you, and I just met you.
Okay.
I'm inviting you to Sunday dinner. I love your spirit. I absolutely do. Lynette is in your hands, baby girl. G
Okay.
baby.
Nice to meet you, Dr. Faith.
Nice to meet you.
So I want to come a little more from the, medical side. I am a EMT in the emergency room. I did 15 years in psych, and I think they all coincide with you see them all: pregnant women with mental issues, pregnant women. We go through a lot of women that have miscarriages, the first trimester, because they didn't know to take care of themselves, or they didn't know the signs to look for, and so they didn't get the help that they needed early. One of my first questions is, how did Maternal Health Awareness Day come? I'd never heard of it before.
It's actually new.
Okay.
I think it was started, I think 2017,
Okay.
2017, 2019, by ACOG, which is the governing body for OBGYNs in this nation. It started in New Jersey, and there was a need for us to bring more awareness to the well-being of pregnant mothers, hence
Okay.
maternal health.
Okay.
So there's so many different health days out there. Everybody knows about breast cancer awareness, right?
Right.
And you see the traction and the marketing and then the fundraising and all of that attention that it gets, which does eventually cause change, right?
Right.
So maternal health awareness day was started recently, um, um, from OB-GYNs, to create awareness of this, because there are so many health disparities, especially affecting communities of color.
Okay.
So that's one of the ways that change can start, at least increase
So,
awareness.
so when we're talking about, let's hit the elephant in the room. When we're talking about communities of color, what who do you think has the highest mortality rate when it comes to maternal babies and things like that?
Is the chocolate people,
The
is women,
chocolate people. Yeah.
yeah, is
Yeah.
women of color.
And why is that?
Um, it's a complicated issue. It's complicated. Obviously, you can't ignore racism. You can't ignore systemic, issues. There's also the concern of physicians, right? What implicit biases that we may have when we
Right.
when we treat our patients. But there's also, lack of access to care. And there's some things that we really don't know, because you can definitely, like, for example, you've heard of Serena Williams' experience,
Yes.
right? You'll hear celebrities have the same type of maternal complications that and these are people who have access to, like, the best care, to money and things like that. And they still have the same type of complications. And one of the common factor is, you're a woman of color. The other thing is, being heard in the clinical scenarios where your symptoms are being listened to and being acted upon, and you're not being, pushed aside. So it's really it's quite complex, to be honest with you.
Now, one of the things that I go out of my way to do when looking
Mhm.
for a doctor is I want to see somebody that looks like me.
Oh, you asking me? Let me tell you. So
Let's
I get
go.
that all the time, and it's actually it's a double-edged sword. I'm gonna be very honest. I'm gonna be very honest. At the end of the day, I think you need to also look for somebody you feel comfortable with, but somebody that's empathetic, right? So medicine is an art, right? Do you have the heart of being able to talk to another human being like they're a human being?
Right.
Whether you are a woman of color or not. Okay. But yes, I do believe that seeking physicians that look like you does provide that initial level of comfort and trust, which may not be, the case with other, in other situations. But yeah, but definitely I get that all the time. But and not just saying I want a person of color, but I want a good person,
Right.
a good person. That's really what you need. You need somebody to go to bat for you in and out of the office room, because they're just a good person and they want you to do well.
Right. So, one of my other questions is, why do you think that there are not a lot of uh doctors of color? I working in the emergency room,
Mhm.
I've seen one.
I can say I think it's also geographic
Okay.
reasons and lifestyle reasons. So where I am in Texas, I was probably the only woman of color OB-GYN for some time.
Okay.
And I found that to be really odd because I didn't necessarily train like that. So I trained in a large medical center.
Okay.
So I think some of it also depends on where the physicians want to actually live and raise their family. Some of it also depends on the workload that they may have
Okay.
to consider, and also depends on the risk that the risk of the population. Certain populations are really high risk to take care of,
Right. Right.
for example. And not just that, you don't have a lot of minorities in medicine to begin
Why
with.
is that?
That's a great question. I think my personal belief is this may be kind of really off topic. I believe a lot of it has to do with mentorship,
Yes.
right? Visibility,
Right.
right? Because what you'll see is getting into medical school has a certain connotation to it, right? Like
Right.
it's and I feel like people defeat themselves before even trying,
Right.
right?
I have a cousin that's a doctor, and I swear she has been in school since I've been in my 20s.
Correct.
And I'm 50 now, and I swear she's been in school forever.
That is too much.
Well, and I say that to say that's another stumbling block because people
Yes.
are like, oh my God, that's such a long time.
Yes.
I don't know if I can do it. I don't know if I'll have the funds, and like you said, they cut themselves off before given the chance.
Mhm.
Another question is, let's get into the maternal awareness. Let's get into the women that are pregnant. What are some of the signs that women should not ignore to reduce preventable complications?
I love that question. I would say one of the, especially women of color, a number one preventable, well, not necessarily preventable at times, but preeclampsia is huge in the community.
Right.
And so there are maternal early warning signs, MUSE, and that includes things like having a headache, things like having nausea, vomiting, obviously the elevated blood pressure, right upper quadrant, pain as well,
Right.
are some of the things that should be looked for. Then there's also the unspoken things of postpartum depression, which a lot, our community tries to shy away from.
It is a real
And
thing.
so, yep, so you have to speak out. You have to talk about how you're feeling. And so with depression, you're typically screened in your pediatrician's office and also in your OB's office.
Right.
But the reality is, do not ever leave especially if you get readmitted for a situation,
Right.
do not leave the hospital without getting all your answers comfortably answered, if
Right.
that makes sense.
It
You know
makes
how something can happen and you'll leave and you're like, well, they said this, do not know. That woman's intuition, the same way you have that intuition to take care of your child,
Right.
is the same intuition to make sure that you are okay.
Right.
So I would definitely say the major thing was with preeclampsia.
Now, one of the things that I've noticed between women of color and our white counterpart sisters is the exercise during pregnancy. It's like you get our counterparts and they running, if they're runners, they run until the baby drops sometimes. But we seem to sit around, become lackadaisical. Not everybody, but you see a lot. Eat whatever you want to. How does exercise factor into that?
It's actually funny you said that because literally today in the office, I was having a conversation and I was saying, women who tend to keep that as a commitment tend to do very well in labor and bounce back. So I think what you said is a harsh reality for some people. And so I do believe being pregnant is not a disability. So you are not required to sit and do nothing just because you're pregnant. Obviously, if there's medical reasons, sure.
Right.
But the concept of I'm eating for two and all this extra, you
Right.
don't need all that. So it can be something as simple as, walking 3 times a week for 30 minutes.
Right.
So really just developing healthy lifestyle habits, right?
Right.
Because what happens is you deliver your baby, you gain the baby weight, you want to get it off, but you're looking for, okay, how do I find the time? I have a baby. So
Right.
develop the habits while you're pregnant so you can continue it, make it a family thing. Get,
Right.
the men involved, get the family involved and things like that. But
Right.
yeah, exercise is definitely really important.
Do,
Extremely important.
do you think that if our men were more involved, that it would be easier for the women when it comes to their health?
I think so. I mean, I think
What
go
could
ahead.
we do then?
I think going to the visits consistently is important.
Okay.
I love this. I personally love to see when the men are in the room.
Mm-hmm.
They actually tend to be more honest with me than my patients.
Wow.
I will ask my patient, "Hey, your blood pressure's high. Did you eat Chick-fil-A or I'm sorry, I don't know if I can say that. Did you eat salty food or what happened?" And no. And then the men will come out the corner saying she
Be
did
like,
this,
girl,
this,
you know you just had that
this.
spicy
Yeah.
chicken sandwich with them potato pie. Hey, speaking of
Exactly.
Chick-fil-A, so you could give me that Chick-fil-A, the what you was talking about before the show. You can pass that to me.
I'm not pregnant.
God dog it, I
Yeah.
tried.
Yeah. So and it's a because I hopefully I don't get backlash for this, but um a woman is pregnant, but the child has a father too.
Yeah.
So I think we have to include the men in the conversations, and I love you for that question.
Right.
I really do. Because a lot of times in reproductive health, we do focus on the woman's body, but the reality is that child has a mother and a father. And so the voices of the men need to be included more and more in the conversations of reproductive health and maternal health. So I
Yeah.
really am appreciative of that question.
And I'm not trying to be funny, but men get queasy. They want to step out the room when the doctor wants to.
That's
But
okay.
you was right there. What you scared to look at? I mean,
It's
come
the
on.
blood. Is the blood.
Wait.
Because even medical students pass out. It's the blood. Birth can be a bloody situation. It's the blood.
Let me tell you, I'm not. I was joking, but you're absolutely right. So I was in the delivery room twice with a friend of mine and my cousin. One was a natural birth. One was a C-section. I saw the natural birth, and I was like, if I was a man, I would never go back. Who knew that your body could stretch that big? I was like, I could have dived in their feet first.
God,
I mean, I was traumatized.
go ahead.
In regards to the maternal wellness aspect, Dr. Faith,
Mhm.
can you share any strategies or resources you recommend for expectant mothers looking to maintain their wellness during pregnancy? Because I know pregnancy can definitely be a tough thing for women.
That's why
You know,
I only
I think that's a great question. So I would encourage them to reach out to their insurance because sometimes the insurance do have wellness programs and things that they are eligible for.
Yeah.
Um, Other things that are really important. This is the one time where I actually sometimes do say buy or look into pregnancy specific things that are marketed for pregnancy specific, like exercises and things of that nature. Um, I'm a firm believer in mental health and stress management. So the minute you are a certain gestational age, I recommend, regular prenatal massages. And so some of these, yeah. And so there are some prenatal places you just have to look that do like spa days and massages and things like that. And of course, if you have, medical issues like diabetes and hypertension, consult your physician to make sure that you are okay. And I know our institution even offers physical therapy for the common, like, tailbone pain and things like that.
I'm mental health is my passion. I love mental health.
Mhm.
So what's the importance of mental health support during pregnancy?
It's important. So what we tend to see is a woman gets pregnant and then they stop all their meds. They don't know if it's going to hurt the baby. They don't know what they should do or take. They're like, I just gotta see the doctor, right?
Right.
You're human. We understand, right? And that may be a correct move in a lot of cases, actually. Um, my main thing with mental health and pregnancy is communication. Communication, so that we can know when to intervene and how to refer you.
Right.
Okay. I've had lots of situations where people were, super happy, super awesome during pregnancy, but then postpartum is a crash.
Yeah.
And they may slightly feel embarrassed to say, hey, this is how I'm feeling right now. I've heard stories of people, in the closet crying. Suicide is a real thing.
Yes.
Literally psychosis, where you have a break in reality,
Yes.
happens. That definitely does happen. So I think that while you're pregnant, having those conversations is important to prevent issues postpartum, because you are needed for that baby to bond. So that bonding moment in the newborn period is very important, but you need to be healthy to be able to do that for your baby.
Right. So what can we do as citizens, as the community, when it comes to racial disparity, um, with women of color, be it brown, black? What can we do to make a difference? You get people don't, how do I say this? I think people say, well, my vote doesn't count. If I go out and say something, nobody's going to care what I have to say. I'm just one person. But I personally think that every voice makes a difference. And the more voices that come together, the louder it gets. Because there's a saying that the squeaky wheel gets the oil, and I think the more noise that you make, the change can come. But what do you suggest? How do you feel about that?
This is just confirmation. What you just said is confirmation for me personally. Um, in terms of how best to help my patients. Yes, I don't ever underestimate the power of your own voice. Um, because at hospitals and in clinics, um, there are certain systems in place. And so when somebody complains, there are systems in place to investigate those complaints
Right.
and to make changes. So if there's enough complaints, a trend is noticed, right?
Right.
And then policies can be developed,
Right.
right? So some of these institutions and organizations, they look good based on patient experience,
Right.
right? The reviews that you get and things like that. So where does that come from? People saying good things.
Right.
So if you have a bad experience, you actually need to say something
Right.
so things can be investigated, right? It could be a simple personality, misfit, or it could be a miscommunication, or could be something more, right? And if you experience that, somebody else might have experienced the same thing as well. So your voice individually should not be minimized. It is part of creating a trend or a pattern that can be investigated so that people who do sit on certain boards of good moral character can make the correct changes for certain communities.
All right. So we do have a segment called Faith in It, where we allow our guests to kind of share their story, their journey of how their faith has gotten them through tough times. And so the reason why I believe this is important, because the word also tells us that the just shall live by faith. And so the revelation is faith becomes a lifestyle, not a moment.
Come on, Guru.
And so for you, considering your name is Dr. Faith,
Come on.
how has your faith allowed you to get through tough times considering the field that you're in?
I think that's a great question. So I my pregnancy, I have one son right now. I had postpartum preeclampsia afterwards.
Wow.
And I thought I was gonna die, guys. I'm not gonna lie.
Wow.
My blood pressure, we were taking a picture and with my family, I looked at the picture, I'm like, whose feet are those? Because my feet were swollen, look like Fred Flintstone. And they're not physicians, so they don't know that that's not normal.
Right. Right.
I'm like, somebody check my blood pressure. It was 200s over like 100s.
Oh,
Wow.
stroke level.
Thank you. You get it. I was like, am I about to stroke out in my sleep and nobody knows? Like, what's going on?
Right.
And I actually, my experience with my OB wasn't the greatest, at all. So I went back to work and I was just like, I just have to get this pressure down. I have to get this pressure down.
Yeah.
Long story short, I use my faith to basically uh, remove fear because I know, when you know too much, you're
Yes.
like, this can happen to me, this can happen to me.
Yes.
Right.
Me, I really had to, speak more positive over myself and again, not believe your own doctor's report
Yeah.
and overcome fear with faith.
Wow.
That is something that's
Wow.
super true, because whenever you know by your studies, your school, your education studies, what that outcome says it's going to be,
Yeah.
you have to have a relationship with God that says, regardless to what I studied, done paid all this money for, and have a degree for, I still believe that God can do whatever God's going to do at the end of this. Because kind of off the subject, but for me, I know you were saying whenever you go to the doctor before you check out, make sure you get all the reports or whatever. The middle of last year, I went to one doctor here in Dallas because the left side of my face went dead, and they told me it was an allergic reaction. They sent me home. I went home for a couple hours, went to sleep. By the time I woke up, my face felt like candle wax was just melting. So I went to another hospital, and instantly, whenever they saw me, they were like, "Oh, Mr. Gilmore, you're going through Bell's palsy."
Mm.
And then they told me what Bell's palsy was supposed to do to me. And I'm listening to them because, yeah, you know what you're talking about. But then the ramifications of what y'all saying Bell's palsy was going to do to me, I'm not even supposed to be able to talk, drive, or do anything right now. But
Wow.
I had to, the church that I'm under, Christ Cathedral, Bishop Sherman Allen.
Yes, Lord.
I had to get so engulfed in what he was preaching and what they were sending me that wasn't what the doctor said, to where now I'm able to do, although I'm not at 100%, I'm not at 10% no more either.
Sir.
So that was a definite true whenever you were saying you have to believe, your faith has to be bigger than what's on paper, pretty much.
That's the word right there.
So I have absolutely enjoyed you. I cook Sunday dinner at 12 o'clock every Sunday. Before we leave, though, tell our listeners and our viewers where they can find more information about you, Dr. Faith.
Oh, thank you. So I'm on Instagram. You can follow me at iamdrfaith.md. And I do have a project I'm working on specifically about what we just talked about, where you use your faith to leverage, healing, specifically regarding fibroids, like the woman with the issue of blood.
Mm.
You can follow me at Mayo Imani, MYOIMANI. And we'll be there talking about being able to use your faith to help fertility and reproductive issues. Thank you.
Everybody, this is the intro podcast. I thank you guys for listening. Thank you all for watching. Share this particular show or even just this segment with a woman in your life, whether it's your mother, your sister, your girlfriend, your boo, your side chick. Yeah, I said it. Even your side chick need to know about what we spoke about today. But on the real though, don't ever think that men don't ever think that this is just something that women deal with, because it took two to make this thing happen, so it's going to take two to get through this thing. It's your boy Taz
And Glenetta.
And Willie Bean.
and we got Dr. Faith in the house. This is the intro podcast. Thank you guys.
Thank you.